Does your skin look like this? Or have you seen skin like this? By the time we finish today's video, you'll be able to recognize folliculitis. Folliculitis, as its name implies, is inflammation of the hair follicles. You're also going to learn some of the things that dermatologists will use to cut down on the symptoms or improve folliculitis. This patient has blemishes on his back. Usually when the same symptoms are showing up on the face, we'll call it acne. When they show up on non-face surface like scalp or back or upper body, we usually call it folliculitis. There are certain symptoms that really stand out in this patient, such as you see the open comedone, sometimes called whiteheads. There are also some pus-filled lesions called pustules. You also can find a good amount of redness and dryness in the background of these skin lesions, as well as some hyperpigmentation. When the skin is trying to improve, or it's getting better from being inflamed, when the inflammation is improving, it has two choices usually. It can lose some of its pigment, in other words, post-inflammatory hypopigmentation, or sometimes it will react by producing more pigment as part of the healing process. That's post-inflammatory hyperpigmentation. There are a number of things that your dermatologist might use to improve the symptoms while you're still in the office. The main one that we would put to work is the cryotherapy. That's the dispensing of cold liquid nitrogen spray directly on the surface of the skin. The cryotherapy is used to cut down the inflammation, in other words, to arrest the inflammation and all the production of bumps and redness and dryness. It also helps to cut down on all of the pigment deposition from the melanocytes. This is the process that maintains this post-inflammatory hyperpigmentation. The other thing that your dermatologist would use in the office may be some intralesional steroid injection. Now, you've got to be careful with some of the side effects of these procedures. For example, in this patient, you would dial down the concentration. You wouldn't use the standard concentration of K10, in other words, Kenalog 10, that's too strong in a darker brown skin patient like this, and it would have higher risk of, hypopigmentation, lightening of the skin, or thinning of the skin, sometimes called atrophy. Now, if this patient had a thicker form of inflammation, or if scarring was a significant problem to be solved, in that case, K10 would be justified, and it would be a good choice. At least you could tell yourself that the associated risk of the hypopigmentation or the atrophy are rare and most usually temporary. The other thing that you could use in the office would be a laser. We use a laser that's called Aerolase, a cosmetic laser. It has a wavelength of light that is specific and suitable for all skin types, including the darker brown skin on this patient. Its target is that continued production of inflammation, the bumps that is. Its target is also the pigment in the hyperpigmentation. And in a patient like this, you'd better make sure that they are comfortable with hair reduction being a byproduct, because Aerolase is also used as a laser hair reduction device. Of course, you're not surprised that we would prescribe things for this patient to use at home. And the main prescriptions that they would use would be hydrocortisone 2.5% lotion applied to the surface twice daily. Also tretinoin, a vitamin A derivative in which they could take a pea-sized amount, water it down, and apply only Monday, Wednesday, Friday, not twice daily like the hydrocortisone. Also, 4% hydroquinone could be a very valuable tool for them to use at home too, because it would cut down on some of the hyperpigmentation. It's a standard bleaching cream. The only oral medication I would use in this case would be the loratadine, an oral antihistamine, which I would ask the patient to take it twice daily. I'm Dr. David Bryant. I'm the proud owner of World's Famous Dermatologist, a dermatology practice in Stockbridge and Decatur, Georgia. We help patients from all races and ethnic groups, but we're probably best known for our expertise in Black skin. The dermatologist that you go to and trust does not need to be a Black American like myself to be qualified to work on Black skin, but whoever you're trusting with these kind of conditions should have experience with a large volume of Black patients and be very experienced with skin conditions that affect darker skin types. I hope you enjoyed today's video. If you did, please like, comment, and subscribe to the channel. Please leave your comments below. I will consider your comments and questions the next time we cover similar content. I look forward to connecting with you on the next video.